Subcision is a procedure used to treat acne scars by breaking up the fibrous tissue beneath the skin that causes the scar to stay depressed. It is usually part of an overall acne scar treatment plan and helps prepare the skin for the next step. Subcision is unlikely to be the only modality used to treat acne scars. Is subcision painful? A local anesthetic is usually injected to numb the area, minimizing the pain during the procedure. However, one may feel that there's some discomfort or sensation of pressure. The downtime is typically 1 to 2 days, mainly due to bruising. The face may be slightly red after the procedure, and this usually fades within a few hours. Bruising is common, and so is swelling. There may be mild redness or tenderness at the treatment site. Rarely this leads to infection or scarring. Subcision is usually the first step of a treatment plan. 2 to 3 treatments 4 weeks apart may be necessary. Therefore, results would be dependent on what's next. Subcision itself provides long-term improvement in acne scars. Subcision is effective for treatment of scars of varying depth from superficial to deeper, more extensive scars. The technique used will depend on the type of scars being treated. While subcision can significantly improve acne scars, it is often used in combination with other treatments like fillers, lasers, or even microneedling for optimal results. One of the most common techniques is to use Noal needles, and this is for superficial scars. It is done at intradermal and subdermal depth. The second technique is for deeper depressed scars. This is done at subdermal depth, and a combination may be necessary, that is, combining the Noal and the cannula technique. For practitioners, you can visit and study the acne scar management module on the ASI website.